So we're actually getting two new pieces of equipment or software. The one that most people have heard of is something called Tomosynthesis. It's otherwise known as 3D mammography. It's still digital mammography, and the machine looks very much like conventional digital mammography does, but the study's done in more detail. So traditionally, ever since mammography was invented 30 or 40 years ago, it's always been a two-dimensional representation of a three-dimensional object, the breast. So even when mammography was regular old x-rays, and even through digital mammography, the images that we see are always a composite image, a compressed image, just two-dimensional image of a three-dimensional object. And that's been sort of the Achilles heel of mammography all along, because you get what we call tissue overlap. So especially if a woman has very dense breasts, that tissue overlap can hide a cancer, a pretty big cancer, in that density. Likewise, because you're compressing all this density together and sort of adding it together on an image, we see things that are suspicious initially, and we have to call the patient back, and then we do additional imaging, and it's just tissue overlap the vast majority of time. Tomosynthesis is hopefully going to solve this issue of tissue overlap. So again, the images are acquired very similar, so a woman's it's not going to seem any different to somebody who's had a regular mammogram or traditional 2D mammogram in the past. But in this case, instead of the X-ray machine staying stationary and taking a picture, the top of the X-ray machine will actually rotate, and it takes several images of the breast. Now, they made these individual images very low dose, so if you add up all those images, it's about the same as a regular image, so you're not getting any more or much more radiation dose. And then what the computer does, it takes all those images and it reconstructs them into 1 millimeter slices through the breast. So a breast typically compresses to maybe 3 or 4 centimeters, so I'll get 30 or 40 images per breast per angle. So instead of 4 images that I get now, which are composite images, I might get 60 to 120 individual images. Instead of having one composite image, I'll be able to see all these different slices through the breast. So all the tissue in front of a slice and all the tissue behind a slice will be gone, and I'll just be able to look at one slice at a time. And the early studies for this new technology has shown that we'll find 40% more cancer and call back 40% fewer patients. So it's sort of an exponential benefit. We're calling fewer patients back, but we're diagnosing more cancer. So that'll save time and money in terms of patients having to come back and forth for additional imaging. And then if we're finding more cancers, we're likely going to be finding cancers that we would have otherwise missed in all of this density. So we're going to find these cancers at an earlier stage when they're curable.